The Compliance Perspectives podcast is sponsored by Case IQ, a global provider of whistleblowing case management and compliance solutions. Learn more at caseiq.com. Welcome to the Compliance Perspectives podcast. I'm Adam Turteltaub from the Society of Corporate Compliance and Ethics in Healthcare Compliance Association. Joining us today from Indianapolis is Colin May. Colin is a professor of forensic studies and criminal justice at Stevenson University. And today we're going to be talking about something he addressed in a recent Compliance Today article entitled Non-Emergency Medical Transportation Fraud, High Risk, Low Oversight. Colin, thanks for joining us. First, let's just define what is non-emergency medical transportation, and then can you give us an overview of how it can be abused?
Yeah, thanks, Adam. Great to be back. And yeah, so non-emergency medical transportation is really a way that, lower income elderly or disabled folks who need to get to their appointments or need to be able to pick up prescriptions have that ability. And so, it's written into the Medicaid regulations, and the states are really oversee the programs somewhat differently, but in general ways. Most of the states are using a broker system so that it's whether capitated or fee for service, that is the way the program is run. And so over the last couple of years, it's been really interesting to watch and see how this has really come in to be problematic in a couple different ways. So we're seeing cases where, for example, they're billing for service not provided, a no-show trip for the patient, but they bill it anyway. Trips when a facility has been closed or the patient doesn't actually have an appointment. We're also seeing billing for ineligible beneficiaries. So say they're hospitalized and obviously can't ambulate, and so they are still billing for those, or even worse, they're dead. So these are the kinds of things that are kind of ripe for abuse. We're seeing overbilling or upcoding, overcharging for things like tolls, like ancillary things. We're also seeing a number of cases where they are really ineligible purposes or trips. So going to non-medical appointments or going to the grocery store, things like that. And then we're seeing issues with either the vehicles or the provider themselves, the drivers, or the transportation companies. So they're not the drivers having a suspended license or criminal convictions, things like that. So it can really be both a safety issue and a fraud issue. And so that's why I think it's really important that we understand what's going on with this type of fraud.
Wow, it's sort of every healthcare issue and rideshare issue all bundled up together in one horrible package. So why is this becoming such an issue, and how prevalent is it?
So that's a really great question. So we're not really sure exactly how it's kind of grown. The Government Accountability Office and states have done different studies looking at transportation fraud. In 2022, the GAO also released a report on the efforts to address fraud in this program, kind of looking at different issues and approaches and kind of how things have been going. And so, when we look at, so for example, like the national healthcare fraud takedown that just took place in earlier in 2025, there were 18 total cases of non-emergency transportation fraud. All but one of them were from the state of New York, which has really picked up steam. They're doing a lot of different cases. both the Attorney General's office, the Medicaid Fraud Control Unit, as well as the district attorneys and the state comptroller's office special investigations unit. They're really picking up steam on a lot of these. We've seen cases out of Florida, New Hampshire, Colorado, Ohio, Indiana. It's really all over. And when looking at the number of open cases based on the last fiscal year 2024 HHS OIG report on Medicaid fraud control units, there are almost 300 open cases, both civil and criminal, involving non-emergency transportation. And then if you add in ambulance providers, that goes up by almost 75 cases. So it's really starting to be something that I think a lot of people are paying attention to.
Wow, that's a lot of cases. So what are the biggest risk areas in non-emergency medical transportation?
Yeah, so I think the biggest risk areas really come down to the typical schemes that we see in healthcare fraud investigations. Whether it is the patient themselves or a family member, whether it's the transportation company, in some cases could be complicit with the provider, or we're seeing a lot of kickback cases too. Unfortunately, in some instances, the transportation companies are preying on patients by giving kickbacks for example, their Medicaid beneficiary information, or kickbacks in order to use their services and sign up. And unfortunately, in one case, they were allegedly sitting outside of a methadone clinic, basically signing patients up as they came in out of the clinic. Right, very vulnerable population, and unfortunately, it's a huge risk, right? And people need the transportation. They need to be able to get to their appointments, and they need to be able to get access to providers. But unfortunately, when people are not being honest, it really creates huge risks across the spectrum.
That's utterly appalling. So what does this all mean for healthcare compliance professionals? Where should they be focused?
Yeah, I think for compliance professionals, the first issue is awareness, right? Just knowing that this is out there. You know, really understanding kind of the key aspects of these types of frauds, and then looking for how it may impact your particular organization. So understanding, the landscape, understanding the context, and the impact to your organization. I think it's also really important to just understand that in some cases, it's actually the providers that are identifying something is up. And so helping train the providers to be able to recognize the signs of these issues can go a long way. So from a prevention aspect, from a identification aspect, the other piece that I think is really important is for compliance professionals to work with their colleagues to look at the different forms and the certifications that are being provided here. So if you're in a direct care organization, how how do those forms look? Are they really going to withstand scrutiny if a full investigation comes down? Um, or are they going to hinder the potential prosecution and recovery of funds? So really taking a look in a deep dive at some of those, I think are really important. In the article, we go through all 7 elements of the compliance framework, and kind of talk through briefly why and how each of one of those can be used in this particular type of fraud risk.
And just a reminder that article is available for HCCA and SCCE members off of our websites. Now, you just mentioned that providers have started identifying these kinds of cases. What should they be on the lookout for?
Yeah, so this a lot of times comes down to where people are living. And so, for example, in a case in New Hampshire, there were a couple that were claiming two different residences and then claiming the mileage for those, and they were pretty far from the provider's clinic. But when it came down to it, what the investigation found was that they were actually like less than a mile from the clinic. So they really weren't eligible for much of the mileage benefit. And so it became pretty apparent to this provider that something was up. And so that's when they were able to notify people, the compliance professionals and then, the investigators. So just basic things like that, anything that looks out of the ordinary in terms of, what they're there for, why, how they're getting there, and just asking those basic questions to understand, how they're able to get out and about can be really helpful.
So, could technology like AI be useful in this area, or am I overly optimistic?
No, I think technology can be really helpful. So I think there are a couple different ways. So first of all, there's both provider and transportation conveyance screenings. So understanding who is driving, what they're driving, making sure that those things are safe and appropriate. Looking at things like pre-trip approvals and having portals and things like that, as well as post-trip validation. So electronic trip logs or GPS data, um, but also looking at it from a holistic perspective, right? Pattern recognition, identifying. So, for example, if you have a driver who only conveys one patient, and that one patient only uses that provider, that transportation driver, well, that could be a red flag that there could be something untoward, right? Or if patient suddenly drops from your transportation network, um, why is that, right? It may be for very legitimate reasons, um, but it's something again to look at the data and be able to really drill down and say, what's going on here. So I think I think the important thing is obviously using the technology in the most appropriate way, and really have a good plan for understanding, again, given the fraud and the risks and the cases, what's out there.
And clearly, there's a lot out there. Well, Colin, thank you so much for talking about this with us today and writing the article for the magazine. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.